with them today, and I'm sure yours are, and I just sort of wanted to acknowledge that first of all. We're here tonight to talk about the very sad reversal of the law that was about to be invigorated by solid work that had been done by the Honourable Dr. Aisha Verrill. What I would say is that one of the shocking things about this is just how surreal it feels. It feels like here we are with a law that is actually going to kill people. A reversal that is so crazy that you wouldn't really have thought about it happening. Even though I knew that I was dealing with a different mentality, I just didn't see that one coming. So I'm going to just, without further ado, pass this on to Aisha to talk about what she thinks. I just sort of also acknowledge that Julie Ferry's come in. At the end, when we've done with the questions with Aisha, because she's going to leave, I've talked to Julie about talking about vaping a little bit at the end of the meeting too. So hang around for that. Thank you very much, Aisha.
Tēnā koutou katoa, and thank you, Helen, very much for that warm introduction. And thank you for the initiative of having us all here. I think you first asked me if we could do this at the end of last year, and I'm pleased we've organised it now. And you also inspired me to make this into a tour. So I did Dunedin 2 days ago, and also visited the orientation week. And then we're on to Hastings tomorrow with Vape Free Kids, where they're having a rally, and then Monday, Palmerston North with Tangi Utikere. So we've we'll have those events, and also there's been rallies here in Auckland already for Smoke Free here and in Wellington, and one in Christchurch. So we know this issue has really struck a chord both with our members and with the public, and I'm very pleased to see you all tonight to talk about it. Perhaps I'll just start a little by why I care so much about this issue, and I know many of you will have your own motivations for caring about this as well. I went to med school at Otago after growing up in Te Anau, and I got a really good training in epidemiology and public health there. And that's part of the experience I drew on later on in the pandemic. But one of the people who really influenced my education was David Skegg, and he later went on to a renowned cancer expert, and he taught us the whole story of how tobacco was not only found to be the cause of cancer, but how that evidence was and how that evidence came to light was actually the birth of epidemiology, the science itself, and how we link things in the environment or hazards to knowing how we prove that they actually cause disease. And he gave us a really good grounding in that, but he also gave, in the course of that study, I also learned about how the tobacco industry had sought to silence the science of epidemiology to stop that information from coming to light. It was heavily contested until about the 1950s. Then when I started as a doctor, I worked in Wellington Hospital, and before I specialised in infectious diseases, I just worked in the emergency department or on general medical wards looking after whoever came to hospital with a whole range of problems. But almost half of the people in hospital had been smokers, and smoking was the cause of why they came to hospital. So it's hugely overrepresented. And as a medical registrar, where I would admit patients from the emergency department to hospital, in my when I was 27, 28, I'd be looking after people who would come to hospital unable to breathe when they're well, enough to be able to walk from their bedroom to their mailbox. Tobacco had caused so much emphysema that had severely damaged their lungs. And one of the things that when we talk about tobacco being a personal choice, I would reflect upon these people who have had all their choice and freedoms actually taken away from them by tobacco, to the point where they had become a prisoner in their own home. I looked after people who had amputations, and there were more than a dozen people who I diagnosed their lung cancer that had been caused by smoking. So my experience of the health system was one where tobacco extracted a huge toll on people and where the routine business of the health system was taken up by responding to the harm tobacco does to the community. And one thing that might surprise you is that tobacco kills half the people who use it. Now, that isn't even the case for guns, but it is, so it is markedly different from any other consumer product we allow in our community. We'll skip over the part of the story where I go and study tuberculosis and learn about contact tracing and go overseas and come back to New Zealand. And then a pandemic happens and Jacinda asks me, I successfully stand and get elected, and Jacinda asked me to be Cabinet Minister, mostly to help with COVID, but I also asked if I could be responsible for the smoke-free 2025 goal, and I was lucky to get that work. And to understand why we designed the laws we did, it's probably worth thinking about where our journey with tobacco control was at that point. Tobacco has been in New Zealand basically since first contact between Māori and Pākehā, when it was part of the trading between Māori and Pākehā. And in the 1950s, Māori had the highest rate of lung cancer deaths of any group found anywhere in the world. So inequities in tobacco use has been part of our community for a long time as well. It was, you'll know well, in this part of the city, it was Helen Clark who started the first tobacco control legislation in New Zealand, which was the Smoke-Free Environments Act, firstly starting with prohibiting smoking in workplaces. And then when Helen Clark was Prime Minister and Annette King Minister of Health, they went on to hospitality venues being included in those environments where smoking was controlled. In 2009, the Māori Affairs Select Committee did an inquiry that travelled up and down the country looking at the impact of tobacco, particularly for Māori, and they heard from people who had lost whānau and a very strong focus on the disproportionate effect of tobacco on Māori. That led the Māori Party in government with the National Party in 2009 to ask for increasing excise tax on tobacco as one of the key policies that they brought in. And they did. And now New Zealand cigarettes are more expensive here than almost anywhere else in the world. And it has had a massive impact, that increase in excise tax, substantial increases every year, to the point that we're now at where we only inflation adjust it from here on. And we've seen that's really brought down the smoking rates. We are among some of the lower smoking. We now have a smoking rate of 6% or so, and that's about the lowest in the world. So that's been very effective. So in terms of Smoke-Free 2025, that was the goal set by the Māori Affairs Select Committee. And it not only meant smoke-free is defined as a 5% smoking prevalence rate, so it doesn't mean no one smokes, but the vast impact of smoking on the public health system will be greatly ameliorated once we're beneath 5%. But the Select Committee also wanted the goal to be also 5% for population group. So for Māori and Pacific as well, the smoking prevalence should be under 5% because they were very concerned about those inequities, and rightly so. So when we, to reach the Smoke-Free 2025 goal, this group at Otago University had done some modelling that showed that even though we were doing very well with the reductions we had due to excise tax increases, it would still take over 40 years for Māori to reach the Smoke-Free 2025 goal on the current trajectory. So they came up with strategies that would help us get to the end, and all of them are really, get to the goal, and all of them are really well researched. So the first was to really reduce the number of tobacco outlets. Currently anyone can sell tobacco. There's no licence like there is for alcohol. and we estimate there's about 6,000 to 8,000 outlets, but it's not, no one really knows. Also, when there's so many and we don't know where they are, it's very hard to know that you're regulating all of them well and that they're not selling to under 18s, for example. So that led to a proposal to bring the number of outlets down to 600, so a tenth of what they are, and that to become an outlet should have to be licensed. So that was one of the proposals we included in the Amendment Act that we passed in 2022. That proposal was particularly important to Māori because they were concerned about the concentration of tobacco outlets in poor communities. And I think it's really important from the perspective of quitting that when you're walking from your bus stop to your house, you're not having to pass 10 different temptations to undo your efforts to quit or undermine your efforts to quit. So that's the first proposal. The second, we had 3 in the Act. The second was to denicotinize tobacco, take the nicotine out so it's no longer addictive. When that is done, as it has been in multiple clinical trials around the world, that leads to maybe 70 to 80% quit rates. It's incredibly effective. Now, it's tough for people who are addicted to nicotine to do that, but in the context of there being vapes and other nicotine replacement available, it is very effective at helping people sustain their quitting. And the third proposal was a smoke-free generation. And that proposal isn't for reaching the 2025 goal. That proposal is to secure our smoke-free status for the future, and it means anyone born after 2009 will not be able to legally purchase cigarettes, or rather, there will be a fine on anyone who sells to them. So it's the commercial sale of it that is that would lead to a fine, not the social supply. So those are the 3 proposals and the 3 features of the law that we brought in, and alongside that we did a couple of other things as well. We vastly ramped up the funding for smoke-free groups in the community. I have been to so many wonderful community groups up and down the country. I'll tell you my favourite example is a group called Kaoti Pacifica in Hamilton, and what they do is they create positive smoke-free spaces for the Pacific community in Hamilton, including waka ama. So the people who go get to engage in sport that is part of their culture, and there are incidentally smoke-free messages while you're there. So it is about creating a positive and healthy community space. It is not about excluding people who are smokers and telling them they can't do something. So that's a really nice initiative, and there are a number like that. And I think our experience with COVID bears out that these small Māori and Pacific health organisations are really good at reaching their communities. The other thing we did, and it was sad in light of some news today, is we increased the funding of customs by $10 million to make sure there couldn't be an increase in the illegal importation of tobacco. So that was a bill we brought in, and ACT voted against it when we brought it in. And Dr. Reti voted, the National Party voted against it, and Dr. Reti said, but we would vote for it if you did the proposals in a different order. So if you did the denicotinisation before the retail outlet reduction, which was a somewhat idiosyncratic view, but and I don't know why, if that was truly the case, they couldn't bring themselves to support it. I went to multiple forums up and down the country where Dr. Reti did not say at all that he would support the scrapping of the smoke-free laws. So we lost the election, and we all felt very sad about that after all the hard work volunteers and candidates had put in. But when the coalition agreement got negotiated, I was absolutely shocked to see that scrapping smoke-free laws was in both the ACT National and the ACT and the National New Zealand First documents. And you can imagine every doctor who has my number was on and nurse on the phone saying, how on earth is this possible? Don't they know how bad this is? And it wasn't, and then we saw 2 days later, Nicola Willis did a Q&A interview where she was under pressure from Jack Tame to answer how she was going to fund her unaffordable tax cuts. And she said, well, the great thing is that we'll be able to use the money saved from the excise we raise by increasing the excise that we'll be able to charge from smoke-free because we'll repeal the smoke-free laws. So effectively saying that the tax cuts would be funded out of more people paying excise duty and smoking more cigarettes. I think it was that in particular that led to a really strong backlash from the public, and it not only captured the imagination of the cartoon drawers around the country who gave the nicknames Dr. Cigaretti and Nicotine Willis, but there are also people in Hastings put on a play about this, and there was, a huge amount of correspondence addressed at myself, but also at the government health spokespersons and the Prime Minister. We know that this law is incredibly popular. We've had polling done on it that's shown that all the proposals in it are popular, and it's been a tremendous pushback from the community. We've seen that in public, and it's also occurred in Parliament, and for those of you who follow the happenings in Parliament on Parliament TV, we really have firstly a Minister of Health who will have nothing to do about defending this policy, which is an unusual interpretation of the idea of collective responsibility, that all ministers are responsible for the government's policies, but he won't say anything about it. And the Associate Minister, Casey Costello, who is responsible for it, has really been unable to articulate a justification for this or for her actions, and in fact is chasing her tail in a bit of a spiral about her statements to Parliament about excise tax removals, which she had secretly sent off to officials, that is essentially sending a wish list for tobacco industry to officials, as Radio New Zealand uncovered. So there's been a lot of happening in Parliament about it as well. 9,000 doctors asked for the proposals to be sent to Select Committee, but our experience in Parliament has been that nothing is going to Select Committee at the moment, and everything is coming under urgency if it's in the 100-day plan. And the other, in addition to the rallies and other events up and down the country, over 100 health organisations have signed a open letter to the government asking them to stop the repeal. And there's been, when I received it, 40,000 signatures to a petition started by Hapai Te Hauora, a Māori community health organisation or health promotion organisation, supporting that the laws remain as they are and not be repealed. So really tremendous public support for keeping the laws as they are, and with good reason, because the law is estimated to save 8,000 people's lives over I think that's over a 30-year period. If you compare that to the government's decision to extend mammography from 65 to 75, that will save 30 people's life, 30 lives or 30 diagnoses a year. So they're just undoing all of the benefit that they can create and putting so much extra burden on the health system through this law. And it will also save, if they left the law as it would save the health system several $1 billion as well. So we have fought a lot over these issues. Of course, the government does have a majority, but I am still hopeful that there is the opportunity for them to see sense, and we continue to encourage people to write to the Prime Minister and the Minister of Health and the Associate Minister as well. If the law may well be introduced in the next couple of weeks, but we do still have options after that. We have the option to think about how we address lobbying interests in New Zealand, because that is clearly a big part of this, and I am thinking about how that could be reflected in a members' bill, perhaps dealing just with the tobacco interests. The other thing we have is the option of a referendum as well, so I know that those are being considered. That is the tobacco story. I do want to talk about vapes as well, because that's been part of our landscape over the last 10 years in New Zealand now. And I think I'd say vapes for me are an example of something that has it's addictive, so it has a quality of virality. That means when I was first health minister, they were less than approximately 1 or 2% use in 15-year-old kids, and they've gone up to, I think, about 12% overall in 15-year-old kids. So just in a year. So that's a massive increase. And then in some groups of young people, 25%, like for Māori youth as well. So over a short period of time, really exploded. And one of the challenges for lawmakers is it's challenging to keep up. So when I came in, Jenny Salesa had held the portfolio just before, and she had done some changes to make vapes R18, to make a difference between specialist vape retailers, where they have all the different sorts of vapes, but they are R18 shops, and the dairies only being able to sell a limited range of vapes. When I first became minister, we introduced the vape-free schools, but essentially these changes, despite these changes, the number of young people vaping increased, particularly in between 21 and 22. So we introduced further changes that came in towards in 2023, and that includes the ban on disposable vapes, the fact that specialist vape stores can't be more than 300 metres from a school. New specialist vape stores can't be more than 300 metres from a school. And we banned the flavours, so you couldn't use flavours like unicorn breath or something that's clearly marketing at students, and you had to use at young people, and you had to use a much narrower range of names. So those are coming in, or either come in or coming in over the next few months. But even as we had brought those through, I think we saw there was the scope to go further, so our election policy was to do even more on that, and that included making vape stores like we sought to make tobacco stores, so to regulate them by having them down to just 600 stores as well, of any sort, and you would have to be licensed. And that makes it easier to be able to police them, because you know where all of them are, and you can do controlled purchase operations and check that they're doing what they're meant to, because clearly young people are getting these vapes from somewhere, and even though they are R18 products. So that was the plan, and we really still don't have a clear view on what the government's proposals are around vaping, really, so that's an area that we still don't know. So I'll wrap up there, because that's I think quite a comprehensive summary of the laws, but I'm very happy to discuss with you either the legal aspects or the political aspects. So thank you very much.
Thank you. I think, Matt, we're going to turn off the recorders now. Yeah, and we're going to go to questions. Thank you. That was extremely comprehensive, actually. It's a really clear picture of what happened, and some of those those highlights are things like that difference in spending, where you save 30 lives or you save 8,000, and they were things I hadn't really